Good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern Feinberg School of Medicine, who answers your COVID questions every Tuesday and Thursday here on the Havey Institute for Global Health's Facebook page. And today, Dr. Murphy will be answering viewer-submitted questions and addressing the latest COVID headlines through today, the 15th of February. And we invite you to continue to submit your questions to us via email at globalhealthinstitute@northwestern.edu or via Facebook at NU Institute for Global Health. And I will be leading the discussion today. So Dr. Murphy, good morning.
Morning.
All right, so with the current statistics, things are looking good. We have an overall 67% decrease over the last 14 days across the United States. In Illinois, it's looking good as well with a overall decrease in cases. We've got hospitalizations down by 35% and deaths have decreased by 3%. What can you tell us about these numbers that we're seeing and continue to see the decrease in cases?
Well, they're coming down and they're coming down rather steeply, but they're still not good. To have an average of 174,000 cases per day in the United States is still too high. That has got to come down a lot more, but it's going in the right direction.
Absolutely. And it looks like the booster shot percentage, we're still seeing that kind of stagnant at 25.6%.
Yeah, that's.
Do you expect that to increase?
Well, because with Omicron doesn't work as well. The vaccines don't work as well with Omicron. But if you've had the 3 doses with the booster, it gets up almost to like the other variants. So it's really more important when we're in the period of Omicron. So the boosters are really important now.
Absolutely. Well, let's go ahead and dive into our headlines. So it looks like there's a story going around. There's a study that's been showing among individuals that contract COVID, one of the new long-term side effects is elevated risk of heart disease for up to a year. What can you tell us about this study and what's going on here?
Yeah, there's been a couple studies recently looking at big population groups, pre-vaccine, post-vaccine, whatever, with heart disease, and particularly in elderly. There seems to be a much more heart disease reported in the year after having COVID than expected. And it's all sorts of things related to the heart. It's not any one particular thing. And it's really unfortunate. And it's just one of the long-term complications of having COVID and yet another reason why you don't want to get COVID.
Absolutely. Our second headline, speaking of Omicron and the decline in cases, Walmart's reported that they're dropping their mask mandate for vaccinated employees, and Amazon is relaxing their rules as well. Do you think we can expect to see more of these larger corporations kind of follow suit here? And is this a good idea?
It depends really what is happening with the pandemic in your region where they are doing this. What we're starting to see here is there's a differentiation between recommendations for vaccinated versus unvaccinated. Now, that's the problem because, unless you're flashing your vaccine card, how's anybody going to know you're vaccinated or not vaccinated? So that's the problem with that approach. It doesn't work so well from a public health standpoint because you really don't know who's vaccinated, who's not. But it is as a result that the cases are going down, and whether or not you need masks when they're that low remains to be seen. You're talking about lifting mandates all around the country and schools and everything else. I would say today, with these 174,000 cases per day, pretty much spread throughout the United States, that we're not ready. I think this is premature. I don't think we're going to have to wait too much longer. You've got decreases in cases that's 67%. a couple more weeks like that, and the cases will really be low, and we will be able to lift mask mandates in many places. So I think it's just a little bit premature now to be taking this approach.
Understood. Well, hopefully things keep looking up and we'll, finally be able to lift those.
Yeah, no, hey, I don't want to wear a mask either.
Well, let's dive into some of our viewer submitted questions. We've got a couple here today. So our first one, we have a individual who is age of 75 with allergies to fish and nuts and also has type 2 diabetes. They've been vaccinated with the J&J vaccine, both doses, and did not have any reaction. With news of J&J suspending production, we think temporarily, what are his options down the road?
Yeah, the J&J decrease in production is a temporary thing. They're having some manufacturing issues. But this person could very easily switch over and get a booster from the Moderna with the Moderna or the Pfizer vaccine. That should work just as well. Matter of fact, it'll work great when you mix and match the J&J and the Moderna or Pfizer. It seems to work even better than giving another J&J vaccine. Plus, the J&J vaccine has its own set of side effects in elderly people over 65. So it's yet another reason to switch to one of the others. The allergy to fish and nuts won't have any impact because there's no fish or nut allergens in any of these vaccine products.
Understood. Our second question here, we have a couple who both contracted COVID from their kids, tested positive about a week ago, and pretty mild symptoms, and looks like they've mostly recovered. Since they had COVID at the same time, they're curious if they're able to, or if they need to refrain from staying together, kissing, or they're wondering if it's possible that they could get worse symptoms for being exposed to a higher viral load after confirmed infection.
No, these people got exposed to the same virus that their kid brought home, and there's no reason for them to have to isolate from each other. They got it together, and they're not going to be spreading enough virus back and forth. They have so much more virus in their own bodies that the little bit that they'd be transmitting is really insignificant. So they don't have to worry about that.
Great. Well,
there's one thing they don't have to worry about.
Yeah, exactly. Our third question, we've received this question many times, and I know that there's, initially they were calling them breakthrough cases, but folks have received their shots, all of their shots, and are considered fully vaccinated, but have still contracted COVID. And now they're wondering if they are needed to get another booster shot.
Yeah, well, it's not approved for that yet. Now, we don't know if these people have an immunocompromised condition or not. If they do have an immunocompromised condition, in certain cases, a fourth shot is recommended, but it's really for very immunocompromised people. Now, in Israel and in South Korea, they have approved a fourth shot, but again, in people who are immunocompromised. So I think it's typically older age, like 60 or 65, and some other risk factor associated with that. And then they're eligible for the fourth shot. But that's just in those two countries, and that is not done here. And the fact that they got COVID on top of all their boosters, actually, that's almost like a vaccine. So you're going to get some protection from that as well.
Absolutely. Well, with our final question, kind of diving in there, folks are wondering how often can they contract COVID? Is it possible to contract COVID again and again?
Yes, you can, because now we don't know if this person is vaccinated or not, but it really doesn't make it does make a big difference, because if you're unvaccinated, you're much more likely to get it again and again. The Qataris, as a matter of fact, Qatar, the capital is Doha in the Mideast, they just reported on a study of how soon after you have COVID can you get COVID again. And I reported this yesterday on WGN, but I think I might have misstated the case. So, but if you get COVID, you're protected from getting COVID again for over 300 days. However, with the Omicron, the protection is less. significantly less than if you got Delta or Beta or one of the other ones, variants of concern. But yeah, you do get some protection. So the protection begins to decrease 3 months after you have the COVID, but it really varies from person to person because some people mount a very strong response to the virus, and some people have a very weak response. And of course, it's the weaker ones, the ones that have fewer symptoms, barely knew they were sick. They can't count on having much of an immunologic response. So it's a little bit all over the place, but as a group, there's protection for over 300 days for the most part.
Interesting. Well, more to come on that, I'm sure.
But one other point to follow up on that is that even if you've had it again and again, if you're eligible for a booster, take the booster. That'll make it even better. Or if you haven't been vaccinated, get vaccinated, and that will help even more. So that in those cases, you'll have a much lower chance of getting infected or getting seriously ill, ending up in the hospital.
Absolutely. All right, Dr. Murphy, well, that concludes our segment for today. Thank you so much.
Great, thank you.